Welcome back to the ED Radio podcast, where we tackle the facts, explore the myths, and provide real solutions to help you take control of your sexual health and confidence. I am Mark Goldberg, certified sex therapist and host of this podcast. For any men who are serious about resolving ED or other sexual challenges, we encourage you to visit our website, erectioniq.com, and use our additional resources. Reach out to us with questions or schedule a 15-minute complimentary Zoom call with myself or one of the team members. We are passionate about helping men like you, so don't hesitate to reach out. On today's episode, I'm going to do something a little bit different or unconventional from the general format. I wanted to talk a little bit about some current event issues. In particular, I want to talk about the tragic shooting of a healthcare CEO here in the United States. And this is an issue that speaks, to, healthcare in the United States, but also to myself, because I am located in Baltimore, Maryland, which is the origin town or city of the alleged shooter in this case. So I want to say a couple things about this situation and connect this back into where I see this as being relevant to sexual health and relevant to anybody who's struggling with a sexual health issue. So first of all, my heart goes out to the victim's family. That's Brian Thompson, who was the CEO of United Healthcare. There is, no excuse and no reason for anybody's life to be taken, irrespective about how you feel about the healthcare system, which admittedly has a lot of flaws here in the United States, as it does in many places around the world. I do want to say also that the shooter did go to a prominent high school very close to where I work, where my office is located. And I have worked with alumni from the school. I've worked with people who send their children to that school. And it is a well-respected and highly regarded institution. And I think it's just important for people to remember that there are a lot of conspiracy theories and a lot of things that are being said about the situation and about this person's background and education and whatnot. It looks very different when you do have firsthand contact with the institution, with the members that make up that institution. I myself did not attend there, and I don't have any direct contact, but I work with a lot of people who do. That community is, hurting as a result of what occurred, and I don't think that it is a fair or good reflection on those people. So as a member of the broader Baltimore, Maryland community, just want to say that our hearts go out also to the Gilman community and also to any of the family members who, even of the shooter, who were trying to do what they can to intervene, to get help and whatnot. And obviously we'll learn more about the situation as it unfolds. But here are some of, I think, the important takeaways as far as I'm concerned. So, and I'll preface this and say it one more time for emphasis, that anything that we're talking about here is, we're not even speculating about the shooter. It's just that it's brought up a number of issues in the different, theories or possibilities or things that were going on in his life. We are not here to speculate on that, nor are we here to excuse any of the actions taken by this person. There is, again, no excuse whatsoever to take somebody else's life. All that being said, first thing I want to say is that mental health is a very, very real part of our lives. And it's clearly being speculated that this person was going through some serious mental health issues. And these mental health issues can really drive people to do things that are unpredictable, way out of character and whatnot. For many of us, when we experience a mental health challenge, it's happening on a much smaller scale. But unmanaged mental health really can spiral, and in some cases really to catastrophic levels.
For too long, men have been told that pills, supplements, and devices are the only way to manage and resolve erectile dysfunction. If you are one of the millions of men who know that their sexual function and overall experience is not just physical, EIQ is here for you. Our one-of-a-kind, self-guided e-course is designed to empower you to jumpstart your process of addressing performance anxiety, building confidence, and enjoying sex again. No gimmicks, no pills, just real solutions for men who want them. Try our course today at erectioniq.com.
Mental health both contributes to and is impacted by sexual dysfunction. It is a very, very distressing thing to experience, as we have spoken about many, many times. But also, being depressed, being anxious are things that can impact, sexuality and proper sexual function. So, if there's any basic takeaway from all of this, is that the quicker people reach out and take steps to take care of their mental health, I think the better their prognosis and the better the outcomes are. And I'm not suggesting that people need to be afraid that their unchecked mental health will lead to catastrophic conclusions. It's called catastrophic because it does not occur with high frequency. But that being said, even if it's 1/10 of the way there, it can be very, very distressing. And if you do have access to help, and you can reach out, one should do so. I want to take a moment also to speak a little bit about what this is also raised and whether this is again not the right avenue to raise this issue, but there are real serious concerns about the healthcare system in the United States. As well as in other countries. And I want to emphasize this, that I don't think anywhere in the world has really figured out how to effectively administer healthcare that is both of high quality and with broad access. Unfortunately, there are financial constraints. So whether your system is one which is run by government and is largely taxpayer paid, or if it is a privatized healthcare system, I want to acknowledge that there are significant challenges that are impacting people's lives. All that being said, I think it's a good opportunity to also talk about just where sexual health fits into the healthcare system. So the World Health Organization, I'm just going to read this really straight from their website, because I think people need to be aware of this, and certainly people in the healthcare industry and in the insurance industry really need to be aware of this. But the World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being related to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all individuals must be respected, protected, and fulfilled. Making universal access to sexual and reproductive health and rights a reality can make a difference in the lives of people across the globe. With persistent efforts on all fronts, we can foster societies where all people can express their sexuality safely, positively, and with dignity, including the inalienable right for people to decide if, how, and when to have children. The health and human rights imperatives are clear. It is time for the global health community to unite around a bold agenda to affirm and secure sexual health as part of sexual reproductive health and rights for all. That is a direct taking from the World Health Organization's website. Now, the reason why I think this is so pertinent is because sexual health is not fully covered by insurance. There are pieces that are covered by insurances, and there are pieces that are not. So like when it comes to erectile dysfunction, as an example, most health insurances do not cover PDE5 inhibitors, which is the Viagra or Cialis, also known as sildenafil, tadalafil. These are generally not covered by insurance. Nowadays, because these pills are generic, one can obtain them at a relatively affordable price. Okay. On the other hand, penile implant, which again is something we've covered in other episodes. It's another form of treatment for erectile dysfunction, far more invasive, and generally when erectile dysfunction has progressed is when to certain levels is when men are choosing this option. That oftentimes is covered by insurance. So even with erectile dysfunction, insurance isn't looking at it as purely a health decision as much as sometimes it is a preference, a priority, something that is viewed as maybe an option. But other aspects of erectile dysfunction are seen as part and parcel of the healthcare system. So there's a lot of confusion about that. Then there are like myriads of other elements of treatment that are simply not covered by insurance because they have categorically excluded it from health. What I've learned by working with people from all over the world is that this is not unique to the healthcare system in the United States, which again has a very large privatized component to it. Even in healthcare systems that are largely nationalized or funded by taxpayers and the government, there also is a selective element to what things are covered and what things are not. And that certainly pertains to sexual health, with most things really not being covered. And this is an ongoing just concern and issue because there clearly is a gap between what the World Health Organization is calling a human right and what insurance companies and insurance systems and whether they're government or private seem to include and seem to not include. This is also one of the reasons why when people ask me why is sex therapy so expensive, why can't this be funded through insurance? It also touches on just another challenge that we see with the insurance industry is that many sex therapists like myself are in very small practices relative to much larger aspects of the healthcare system. We're not generally part of major hospital systems. We generally just congregate in small practices or in solo practices. And we do not have a lot of ability to work with the insurance companies. So many practices are very limited by what type of quality service they can deliver and are faced with a choice between operating outside of insurance networks and being able to provide the care that they deem to be necessary and quality to the people that they see, versus working within the insurance companies and having to deal with reimbursements that oftentimes are inadequate just to maintain a basic livable wage. And oftentimes treatment and treatment course ends up being dictated by the insurance companies, which again puts certain limitations on what a provider can and cannot do. So these are some of the challenges that we face. And unfortunately, this issue has kind of come back to light into the public space with everything that's going on here. The other point that I wanted to raise, and again, this is not my analysis or whatnot. This is just there are different aspects and elements to the situation that unfolded. But one of them that was raised was the possibility that this person faced an injury that was debilitating enough that it was interfering with at least the ability to engage sexually with a partner. Not sure what the exact health issues were and whether they even are the truth or if there's any reality to this. Time will tell. But at the time of this recording, this is at least one of the issues that has been speculated. And again, it just brings to our attention the importance of sexual health for mental health. It can seem like it's a really small thing that a person is limited sexually, but if this were to be the case for a 26-year-old to be experiencing potentially what is a chronic condition, it's very, very distressing, not just from a health standpoint, but also being faced with the prospect of the possibility that partner sexual activity would be extremely limited, if not precluded entirely. That's a very, very difficult thing to be facing as a young person who potentially has a lot of life to live ahead of them and would want to be able to engage in partnered sexual activity over the course of the lifespan. Again, we don't know if this was one of the factors, but it certainly is something that was being floated. I also don't want to imply that this is a cause for what this person did. I want to, again, try to just reemphasize that, but it can be very, very distressing, and it certainly could be a contributing factor if that were to be the case. The last point that I want to just make on, again, some of the speculation about this case is the potential use of heavier psychedelic drugs. As marijuana becomes a more prevalent part of at least here in the United States, with the legalization of marijuana, its use is becoming more and more prevalent and whatnot, which I understand is not necessarily a psychedelic, but it does have very significant psychoactive effects. And with the use of marijuana and other psychedelics that people are using and experimenting with, and in some states, psychedelics are gaining some traction to become legal. These are very impactful drugs, and they do run the possibility or the risk of inducing anxiety or changing the way that people think over time. I'm not saying that everybody experiences that. I'm not saying that everybody is prone to that, but it is a risk. It's on the label of legal marijuana. It's one of the potential side effects. And when people are distressed, they do oftentimes seek out mind-numbing agents, and psychedelic drugs being one of them. It is really important for people to seek help if they are finding themselves using these psychedelic drugs or using any drugs really, certainly non-prescription drugs, on a consistent basis. It really is a dangerous thing for some people. And in particular, if you are already distressed, if you already are anxious, sometimes these medications, I call them medications, but sometimes these drugs do serve to take off the edge of anxiety, but a lot of times it actually exacerbates underlying mental health issues. And again, just speaking from the mental health side, and a little bit less from the sexual side, like this is not the best way to manage these things. Psychedelics are being researched, actually, right here in my backyard, back here in Baltimore. Johns Hopkins University is running a major study on psilocybin and other psychedelic drugs. To test what, if any, would be an effective protocol for which mental health conditions like depression, anxiety, etc. But again, these are being done in very controlled atmospheres with very controlled dosing and obviously a lot of quality control on the product. So I want to just emphasize that there is a time and a place for some of these drugs when done thoughtfully and intentionally and under the care and guidance of medicine. We don't necessarily have those protocols at the moment, but overuse of psychedelic drugs and drugs in general can really spiral somebody into a mental health crisis, which, again, we are not speculating and we are not suggesting that that's what happened, but that was one of the issues or one of the possibilities that was raised with regard to this case. The use of psychedelic drugs and drugs in general also, like we've covered in some other episodes and we will continue to cover as these become more and more prevalent, can have detrimental effects on sexual function and mental health in general. So in short, our hearts go out to the families of the victim, also to any of the family members who were doing what they can to try to get this family member who unfortunately went out and did what he did, allegedly, to get him help. Our hearts go out to all those people, but it really kind of just helps to raise our awareness of the importance of sexual health, the importance of mental health, and the challenges that we face as a society and as a world in terms of finding viable ways to get people the care that they need.